Right-wing misinformation took the internet by storm this week when hundreds of media outlets repeated false claims that the federal government was planning to pass out crack pipes as part of its harm reduction strategy. This is completely false and a classic case of conservatives misconstruing data and facts to throw shade at the Biden administration. Now, we expect this kind of behavior from Republicans, who have for years conjured up racist narratives about black people who suffer from addiction and those that rely on public assistance. You can always count on the GOP to spread lies and deceit about our communities and to villainize those who are most in need of support. But what was most disheartening about this week's big lie is that black media jumped on the bandwagon. Dozens of outlets, including this one, parroted this nonsense and shared articles and tweets, feeding into the social media fury. The public backlash was so bad that by the end of the day, the Biden administration issued a joint statement from the Secretary of Health and Human Services and the White House Drug Policy Advisor to dispel the myth and to clarify the particulars of the program. So let's be clear. The federal government is not spending $30 million on crack pipes or any other kind of pipes for that matter. But here is what they are doing that was taken out of context. For the first time, the Department of Health and Human Services is offering $30 million in grant funding to service organizations and local governments across the country for harm reduction efforts. So what is harm reduction? According to the National Harm Reduction Coalition, harm reduction is a set of practical strategies and ideas aimed at reducing negative consequences associated with drug use. Harm reduction is also a movement for social justice built on a belief in and a respect for the rights of people who use drugs. Drug overdoses are at an all-time high in this country. The Centers for Disease Control reported over 90,000 deaths due to drug overdose in 2020, which was the worst year on record. And early reports suggest that 2020 may have even been worse. Opioid addiction continues to be a huge public health crisis, and unsafe drug use is destabilizing families and ravaging communities of all walks of life. Addiction transcends race and class and geography. And it's a good thing that our government is now willing to invest in interventions to help people. That's what we should be talking about, how to help improve people's lives. Shaming and finger waving isn't going to cure addiction, but what we can do is provide resources to mitigate harm. This new federal grant program funds solutions that have been long proven to decrease the risk of engaging in illicit drug use, like distributing the drug that reverses overdoses, providing clean syringes and needle exchanges and other materials that promote hygiene and reduce the spread of infectious diseases like condoms. This also includes smoking kits, which are the source of the controversy. Smoking kits contain lip balm and wipes and rubber tips that would go over pipes, but do not contain any actual pipes themselves. The goal here is to reduce the sharing of inhalation devices and the health risk that comes along with communal smoking. Surely harm reduction in and of itself is controversial. And it's no wonder that the same people who want to ban sex education and scoff at anyone handing out free condoms are also the ones who are against efforts to make illicit drug use safer. But here's the thing. We are not going to stop people from partaking. And these strategies, they save lives. They have been employed for decades all around the country because they are effective. The federal government is following the science and the social practices that work. At the end of the day, isn't that what really matters here? Helping people who actually need help? A few months ago, I interviewed Dr. Carl Hart, a professor of psychology at Columbia University who has for 30 years pioneered some controversial research on recreational drug use. He made a great point, though. Take a listen.
So most of the people who use these facilities are people without homes. And so in part, these facilities are helping to do something that our society has not done. Make sure everyone has a home, because if people had homes, we wouldn't need these facilities.
The vast majority of us know somebody who has struggled with drug abuse. Would we want them to be unsafe? To risk being caught out in public, strung out in a park somewhere in the dark, alone, exposed to so many other dangers like robbery, assault, rape, or arrest, poverty, and housing insecurity, as he mentioned, depression, poor health care, structural racism, all of the societal issues that we talk about on this show depress people's life outcomes and drive far too many to perilous addiction. So what if we address those issues? If we invested more in wraparound services to support people who numb their condition with drugs? What if we boosted communities and gave people a reason to believe in their abilities and to have hope? How different would their life outcomes be? To even begin to address the root of addiction and societal displacement, we must believe in the humanity of the people impacted, not reinforce ignorant stereotypes about them. That's the trouble with all of those headlines. Thankfully, some outlets have retracted them, but the rabid right wing is still on a tear. So let's not give them any more fuel for their fury. At minimum, it is important that we scrutinize the salacious headlines we see, especially those with racist undertones, before promoting them. And please, let's all take a beat before we retweet and make sure that the source is credible and the information is accurate. I know the sensational is sexy these days, and everybody's eager to glom on to the clickbait and willing to believe the outrageous because, well, we all like to be entertained. But if the last election cycle taught us anything, it's that disinformation is dangerous, and conservatives will stop at nothing to champion a big lie. And too often, it's at the expense of Black people. We owe it to ourselves and to our society to do better.